Hello and welcome to my channel. This is Pritesh Jadhav and today we shall be dealing with one of the most frequent symptoms of clinical practice, that is headache. So let's get started with how to approach a patient of headache. Now headache is one of the most common reasons that patients can seek medical attention. Headache can either be a primary or a secondary headache. Now the first step is to distinguish between the serious etiologies and the benign etiologies that can cause a headache. Symptoms that raise suspicion for a serious cause should be noted. Intensity of the headache is rarely of diagnostic value. Most patients who present to the emergency ward with the worst headache of their life have migraine. Headache location can also suggest an involvement of the local structures, like a temporal plane is seen in a giant cell arteritis. Facial pain is seen in sinusitis. A ruptured aneurysm can show an instant onset pain, whereas a cluster headache that can show a peak over 3 to 5 minutes. A migraine can show a peak between minutes to hours, and the peaks can differ in intensity from time to time. Provocation by environmental factors suggests a benign cause. Complete neurological exam is important for the evaluation of headache. If an exam is abnormal, or if a serious underlying cause is suspected, an imaging study like a CT or MRI can be conducted as the first step. A lumbar puncture is often required when meningitis is presented, that is with a stiff neck and fever in a patient. Or a subarachnoid is suspected after a negative imaging is done. The psychological state of a patient should be evaluated since the relationship exists between pain and depression. One of the most frequent and clinical causes of headache is migraine, and the treatment of which is discussed in this video. So let's see how a patient is treated of migraine. Firstly, there are three approaches to migraine treatment. First, a non-pharmacological approach, like there is an avoidance of patient-specific triggering factors. Information for this can be available on acnet.org. The link is in the description. The drug treatments of acute pains and prophylaxis like sumatriptan, amitriptan, others can be used. Drug treatments can be necessary for most patients of migraine, but the avoidance or management of the environmental trigger factor is sufficient for some. Now, general principles of pharmacological treatment can vary. The response rate for these drugs can range between 50 to 70% of patients. The initial drug choice is empirical, that is, it is influenced by the age, the coexisting illnesses, and the side effect profile of the patient. The efficacy of the prophylactic treatment may be involving several months to assess with each drug. When an acute attack requires an additional medications, for that is 60 minutes after the first dose, then the initial drug should be increased for subsequent attacks to lower the pain for the patient. Mild to moderate acute migraine attacks often respond to over-the-counter NSAID medications like paracetamol or aspirin when they are taken early in the attack. Triptans are widely used and also have a recurrence for pain after the initial relief. There is a less frequent headache recurrence when ergots are used, but there is a more frequency towards side effects in these patients. For prophylaxis, a tricyclic antidepressant is a good first choice for young people with difficulty of falling asleep, whereas verapamil is the first choice for prophylaxis in elderly patients. If you enjoyed this video and found it informative, please consider liking and subscribing to my channel to bring more such videos to you. Thank you very much.